Welcome to the Passion for Patients podcast. I'm Tonya Winders, the president and CEO of GAAPP, your host for today's podcast. Together we are working to ensure that people live better and breathe better. And today on the podcast, I've invited back Vildana, who leads our Eastern European Alliance, to talk a little bit about the work that we have on tap in 2025. So Vildana, welcome back to the podcast. Glad to see you.
Thank you. Always happy to see you.
Yeah, as we get started about the Eastern European Alliance conversation. So first of all, we'll just call it the EEA for short, because that makes it a little bit easier. Tell me a little bit about how you got involved in the EEA and began working with other patient advocates in Eastern Europe.
Well, first, I've been involved in GAAPP with our membership, because the association is the member of GAAPP from 2020. And every year we have great meetings where we brainstorm and talk and we share opinion. And I thank you for hearing the opinions and different attitudes. And out of that opinions and great thinking, someone or you mentioned Alliance as a great choice to build and start regional groups of patient experts in order to change a situation and position of patients in their own regions. So as I remember, that was during one meeting in Barcelona, we were in different kind of groups working, and that was the idea worth of listening to start the Alliance in order to make some more, let's say, accurate or more tailor-made changes or solving of the issues, which is for this specific region. And that's how everything started. So I want to congratulate GAAPP to put this as a strategic move to, in your foundation or platform organization to start these kind of alliances, because definitely that is very welcomed in order to solve issues of the specific region and specific patients.
Yeah, it's so fascinating to me when we come together as all the different advocates across the world at the GAAPP summit each year. And what I really began to realize is that, we've got the 6 WHO regions that are well established as the regions of the world. And yet there are nuances even between Eastern and Western Europe and in the way their healthcare systems are structured, in the way patient advocacy plays a role within that health system, and in the access to care and access to treatments. And some of it has to do with being low to middle income countries versus, more well-resourced countries, but so many different challenges and nuances that's really where the alliance concept was birthed, is because of the differences between Eastern and Western Europe specifically. And now we've got the Eastern European Alliance. We've got the LATAM SARIAL Alliance that covers Latin America, Central and South America. And then we're launching North America, Africa, Asia Pacific, all in this upcoming year. And so we're so excited about these alliances. What are some of the keys to really building an effective regional alliance, since you guys are a little further along than most?
Before I try to answer that question, I would just add something to what you have just said about these common issues and problems that we all witness depending on the region, but also what is very, let's say, medical wise or health wise. We are same people, it's not the same same anatomy. If you compare people to Eastern Europe or Africa, it is different. It's different microbiome. When we talk about intestines, we eat different
Yes.
food, eat different kind of allergies we experience. So it is something that can be that can have very very positive outcome at the end. With really projects that can make some change. So regarding the question that you have about the effectiveness of alliance, so what are the, let's say, key factors to build effective alliance? Let's say the first thing that I think it's always first thing, it's shared goal, share motivation, shared problems, let's say. So we have it, and we are all very motivated to improve patients' lives. So these are our goals. And when you have them, then definitely you have to continue with transparency and communication, which is very transparent. And that communication leads to collaboration. That communication, open and transparent communication, fosters collaboration. And if you don't have collaboration, you don't have alliance. You can have projects and you can have people raising their hands and everything, but if they don't put the effort and time to change and to contribute to the alliance, you don't have real alliance. You just don't have it on the paper. So I believe those two factors are very important, as well as strong leadership, because I must say it's not, I believe it's not always easy, to translate all attitudes into one, and stay always focused, because it's always important to have that focus in mind. However, at the end, you always have to share with the alliance the benefits, for every and each organization and patient expert involved in the alliance. They all they have to feel the benefit that they get out of the alliance. And thanks to GAAPP, I'm really happy to lead this Eastern European Alliance, because we already see the benefits, and in future we will definitely define what are our specific goals when we talk about capacity building of each organization. Because what I strongly believe, that we can help each other to grow. Not only that we can work on the specific project, but we can help each other to grow. And that's the idea of every alliance.
Yeah. I always say, if you want to run fast, you run alone. If you want to run far, you have to run together. So we each can do our own organizational objectives and move things forward, maybe in our own country or in our own region. But if we're going to make broader, effective change across a region of the world or across the world, it's going to take all of us working together. And it's those fundamental things of having that shared goal, building trust, acting in a transparent way, holding one another accountable to those actions. And I think these are the things that we believe will be effective in the Eastern European Alliance in the days to come, and in the work that we're doing across other regions. So let's talk about 2025 and what's on tap for the EEA. What are the aims and goals? Where are you guys at right now in the scope of your first project? And what can we expect in the new year?
We are in process of developing the goals, the goals for 2025, but we have some goals that definitely will be something in every year. And those goals are something which is connected to joint project and projects that can, as I said, work on capacity building, as well as the projects that can deal with access to treatment. And what is the beauty of having alliance, that you can communicate as a one authority, one entity. I mean, when you talk to pharma industry, when you talk to this is the great opportunity for fundraising, because these projects can have better and higher impact if we work all together. So what we will be focusing in 2025 are projects related to building partnerships with healthcare providers, and that's something that we talked, like policymakers, and how we can share our expertise among each other, among us, in order to build effective relationships with policymakers, as well as to work on the projects that can be, scaled and that can be easily applied in every country member of the alliance. So more and more details you will hear very, very soon. But having these kind of alliance give us credibility, and I believe this is the way to get what we want from different partners. And if we become stronger, if we say how many of patients do we lead and how many organizations do we have in an alliance, that definitely communicate strong and power. So hopefully we will grow, and hopefully we will have projects and develop an end project that will be very impactful for the society.
Yeah, and I think specifically this area that you guys are exploring of mental health, right? So mental health across multiple atopic conditions. You guys, there are organizations that focus only on atopic eczema. There are organizations that focus only on asthma or only on respiratory, and then there are organizations that have more broad disease areas and scopes. But this common thread of mental health across atopic conditions is one that we know exists, but there's no data when it comes to Eastern Europe specifically across atopic conditions. And so taking this on as a first aim to really ensure when a person is living with airways or atopic conditions that their mental health is being assessed and considered, and that we understand some of the trends in your region of the world to better advocate for those individuals. Like, that's the goal of this first project. And to me, I'm excited to see how it all comes about and how we gather data that will help the individual, but help the collective good as well.
Thank you for helping us. Thank you for helping us to be present, because if you don't have data, you're not present. No one will recognize you. And having data about your patient and about your country is the only way to communicate, to fundraise, to advocate, to change. And I really want to thank you for having that in mind. And hopefully with this first project that we are in the ending phase right now, we will prove that patients with chronic diseases experience mental health issues in this part of the world. And that will be the signal, hopefully, to do some changes.
Yeah, well, thank you, Vildana. As we close out this episode, I just want to thank Vildana for her time, for her leadership of the Eastern European Alliance, for the way that she is galvanizing her regional patient advocates and getting them behind a great cause. But the way they share that passion for patients and stand in the gap for so many millions of people living with these conditions. I also want to thank you, our listeners, for tuning in today. Definitely, if you're in Eastern Europe, if you're interested in the work that they're doing in mental health, check out the details in the show notes. Share this podcast with other patient advocates that are in the space that may also want to get involved in the Alliance and the work that they're doing, in GAAPP and the work that we're doing. Check out the downloadable resources, and don't forget to check out the new upcoming episode of Passion for Patients podcast. Until we meet again, stay passionate.